Whoa, 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 yeah, we are in the place to be. Yeah, 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 yeah,
All right, good morning, everybody. Thanks for being here today for the Kirk Anderson Show. My name is Kirk Anderson, and I have a special guest today, Dr. Vivian Rider, who is a pediatrician, and we're going to get into talking about her unique way of doing medicine. And before we get started, I want to give a special thank you to Drydenwire for having our show on his network, and give a shout out to all the great things that Ben is doing in his space on dryandwire.com and on Facebook. So before we get started with talking about your practice, I just wanted to give you an opportunity to introduce yourself and talk a little bit. We've just met here for the second time. I met you at Wanigan Days and introduced myself and asked if you'd like to talk about what you do. But other than that, I really don't know a whole lot about you. So I wanted to give you an opportunity to just introduce yourself to anybody who might be out there watching this. And this will be on Facebook and YouTube and also dryandwire.com. So hopefully we can get some good exposure for you. So Dr. Vivian, tell us a little bit about who you are and what brought you to St. Croix Falls.
Yeah, well, thanks for having me. I've been a pediatrician for over 30 years, and mostly in the Twin Cities. I recently moved to St. Croix Falls for a couple of reasons. One is I have family in the area, my kids and my grandkids, which was a huge draw. And I also moved into the Tiny Timbers Tiny Home Agrihood, which is just a really amazing place, and the fact that it was going in close to my family and something that I love gardening, I love being in nature, I love being in the community. It was a perfect fit, and so that's how I got here. And I just moved into Tiny Timbers in July, so still really kind of getting settled, but I love it. It's a great place for me.
Yeah, if you haven't been watching our show for a while, we did have a whole episode on Tiny Timbers, a small tiny house community in St. Croix Falls. Very unique community. It's not just a tiny house, it's 16 tiny houses in a agrihood. So go watch that show. And you were one of the 16 that decided to live there. Now you haven't been there through a winter. And
right.
Last winter was pretty mild. So we'll see. You'll have to come back and tell us how how you fared through the winter. But things up there are looking amazing, and I know that they're getting a lot of attention. There'll be some TV shows coming out with regards to what Miss Jones and her husband are doing up there, so that's exciting.
Yeah.
So cool.
And one thing about winter is they take care of snow removal. So, something that I always had to, deal with everywhere else. It's like, well, the winter won't be as bad if I don't have to, be shoveling my car out.
Yeah. So you're in a tiny house. How tiny is your house?
My official square footage is 400 square feet.
Okay.
It's 40 by 10, and then I have 2 lofts, which add to make it a total square footage of about 600 square feet.
Okay, but we don't count the lofts in the square footage for tiny.
Right.
Yep.
Exactly.
So you have it's actually probably one of the bigger ones then, because of the some there are less than 200 square feet.
Right.
So they're very tiny, and I've been in some of those to tour them. So, so congratulations! I'm glad that you're in St. Croix Falls and taking part of kind of the experiment of tiny living. What are your initial thoughts of it?
It's great. I love having friends right outside my door. If I'm cooking and I say, I can just send out a text and say, does anybody want to come sit on my patio and have dinner? And We have lots of activities going on. I'm in the chicken group. We have 20 chickens, and we take care of the chickens. We call ourselves the chicken tenders. And I'm in the gardening group, and planting. Everyone there has a raised bed, and then we also have a big community garden, which we're right now working on planning for next summer. And
have they harvested honey yet? Is that done?
Yeah, that happened about 2 weeks ago, and we have three beehives, and we harvested about 230 pounds of honey a couple weeks ago, and we had a festival for the community, the Honey Harvest Festival, and that was really fun.
Yeah, it was fun. I was out of town with some family medical things with my dad who passed away, but I unfortunately missed that. That would have been a lot of fun to be a part of, and I've done one in our neighborhood because the Joneses live in my neighborhood, and they have one at their house too, where they invite the community to come, and then you can get some honey. So we've experienced some of their delicious honey as well.
It's great.
Well, that's really cool, and that's a unique living thing. But you also have something pretty exciting that you do as a pediatrician and as a MD for many years. And I'll just let people know that are watching, if you have questions, feel free to post your questions in the comments. I'll see those and can put them in as part of the show. But we are going to talk a little bit about your practice and why it's unique. One is you're not working at a clinic or at a hospital, but you're doing a private practice, which on your website it talks about something new and something kind of old. And it kind of likens back to the days where doctors would come out and visit you at your house, and it was much more personal and things like that. So tell me a little bit about what you're doing in the pediatric realm and what ages you deal with, and just what makes it unique compared to bringing my kid who has a cough or something over to the clinic and trying to get in there.
Yeah. Well, I named my practice Full Circle Pediatrics because I feel like in my career I'm coming full circle. When I became a doctor, it was to help people, to take care of kids, to work with families. And over time, I felt like medicine became such a business. And, it more and more, and especially recently, it's getting to be about seeing more patients every day, having shorter visit times, getting graded on how many patients you can see in a day. And basically, doctors are just really losing their autonomy. And so I feel like I'm going back to what really medicine means to me, which is taking care of people. And, like Kirk mentioned, the old and the new. It's my practice it's called direct primary care, which is sort of a new model in healthcare. The oldest ones that I know of started about 10 years ago, so really new. But it also feels like old to me, like he mentioned, being the town doctor who you can call if you have a question. I'm doing home visits, and my practice will be small, so I'll really have time for people and get to know the families in my practice. So I didn't even hear of direct primary care until about 2 years ago, and I was just like, I wish I'd known about this a long time ago, because it's perfect for me. And really, I've always kind of practiced this way. I've always for kids, like if I have a patient who's really sick, or a mom of a newborn who's really struggling, having difficulty with breastfeeding or whatever, I've always given them my phone number and let them text me. And that's what I love about medicine is really having a connection. And so this is all fitting in with really what I've always wanted to do.
I grew up watching Little House on the Prairie.
Uh-huh.
And I remember Doc Baker, and they always try to pay with a chicken. Do you take chickens for payments? But I think that that's a unique model. I do have 5 kids, and over the years, we've watched, my oldest is almost 20. He was born here in St. Croix Falls. We had one doctor who was with us for all 5 of our children. He's now retired from medicine. But when we would take our kids, or when we would go in ourselves for a physical, he would take as much time as he wanted. It was very personal. He would dive into any concerns, and we always left almost feeling overwhelmed with, like I kind of got to get back to work. But he always took care of us, and it was always such a great thing. My wife absolutely loved that. And over the years, things have changed. I can relate to what you were saying with they switched from hand notes to dictation to now you're just on the computer. So no offense to the doctors, but when I've gone in, they spend more time typing than looking at me and just filling out their boxes. And within 15 minutes, it's like, all right, thank you. And you almost feel like you didn't get your service done. And at my age, there's a lot of things to check. So you want to make sure that you're getting everything done thoroughly. And you want to, not forget that mole on your back that you're being rushed to get through. And so I do feel that like, boy, it would be really nice to just feel like they heard you and they paid attention to you and not just looked at the notes. And there's a lot of pressure from hospitals to get through that many patients. And so I've heard doctors who have been a bit critical, saying, man, I just don't have time to do it. I can't. I've got to get these numbers of patients through the door and another one in the waiting room. So that's unique. So what does your practice entail for pediatrics? What age groups are those? Is that newborn to 18, or is it less than that?
No, newborn to 18.
Okay.
I definitely, have seen teenagers, and probably if an 18-year-old wanted to start with me now, it would make more sense to, go with family medicine. Sure. Because they're going to transition. But really, I see all, kids up to that age.
Okay. And what is your typical appointment? What's unique about you is you're not at a clinic where they have to come to you. You go to them, but it's not just in-home care. You also do telehealth and video conferencing, things like that. So how does that all work in today's day and age? I know through COVID, we were kind of forced into that. And now you can set up appointments with doctors online. That's not abnormal to see someone over a screen. But how do you perform that check and get a thorough examination when you're doing it that way?
Yeah. First of all, I think seeing people in person, especially children, is really important. And I, especially when I'm, first meeting them, it's really important to do a good physical exam. And so I'm definitely not saying that I'm doing all telemedicine at all. But the visits that I do can be done in your home. And I have a pretty far coverage area that I will go to. Basically about 30 minutes drive from St. Croix Falls. Okay. So it's with summer driving.
Sure, yeah. Winter might be a little more challenging.
Winter will be a little different, but... and I do actually have an office in Osceola.
Oh, you do? Okay.
So, there's some families that would prefer to go to a clinic, and so that's an option too. So there's, lots of options. But for things that come up, like if we have a visit and then, the parent goes, well, oh, I forgot to ask about this, they can just text me and we can get that answered. Or if they have a question about something that, is not something that I feel like I have to see the child, like maybe pink eye or something like that. We can just handle that with a text or an email.
Sure. So I remember being a nervous dad, and my wife gives me a little bit of a hard time about it. She's maybe watching, but going into the doctor's office and asking questions that for her were maybe no big deal. I knew that, but I had to ask the doctor a specific question about, like, is his leg supposed to be that curved? And my wife's like, yes, their baby legs, they're curved. But that would be something where you wouldn't need a visit necessarily. That could just be like, take a picture and send it, and you could certainly follow up with a visit if there was a concern. But otherwise, a lot of it could be just relieving dad stress.
Yeah.
So that's
And
kinda cool.
I'm glad you brought up nervous parents, because that's one of my favorite things is working with nervous parents, because as a new mother, I was the most nervous mother on the planet. I had just finished medical school and residency, and I knew too much. And, every time my daughter had a fever, I was sure she had meningitis. And, I
get
just...
that on Google too. Don't look
Yeah.
things up on Google.
Right, for sure. That's a new thing that gets parents scared. But, so I just feel like I have so much empathy for parents who are really nervous, and especially first-time parents. It's you don't really get any training on being a parent, and you bring home this precious, beautiful baby, and you feel like you don't know what to do, and
Right.
so I feel like that's where I have really gotten close with families, is when either a sick child or a baby who's having trouble breastfeeding or something like that, where we really talk a lot, and I've gotten over being nervous just from life experiences, and it's like all the things I worried about didn't happen.
Right.
But I really like being able to reassure parents who are nervous, that I really want to talk about their questions and concerns, and reassure them if everything is normal, or figure out what's going on if there really is something concerning going on.
So you may have children that you have at home that are in that age group of 0 to 18 that are still in the pediatric care. Or you may have grandkids that you see the stress of a parent, that you may want to point towards watching this, so that they can understand that there's other options than bringing a child to a clinic. I always hated bringing my child to a clinic, because that's where a lot of sick people are. And it seemed like whenever we would go to the clinic for a well check, they'd get a cold or they'd get something like that. And it never felt good to go someplace that, just didn't feel good. So,
And especially with a newborn, you have a baby and you're supposed to go into the clinic on day 3 or 4, and
Right.
You go to a clinic and all the kids are coughing, and
Right.
I really, really like being able to do newborn visits at home.
Yeah. So who would be your target market for your services? Like, who would you want to reach out to you, other than anybody? Like you have to have kind of an idea of who your perfect client would be, and how would they fit into your practice?
Yeah. Well, yeah, I think I should explain a little bit about how direct primary care works.
Yeah.
It's actually a membership program where families pay a certain amount each month, and it doesn't involve insurance. I'm keeping my prices as affordable as I can, because I really want a lot of people to be able to do this. People might have heard of concierge medicine, where people with a lot of money pay a doctor an exorbitant amount to be their doctor for them. And, some people think this is like that, but it's really not. I think it's, for a lot of families, it's very affordable. Can I say my price?
Yeah, absolutely.
Okay. I'm charging $75 per child per month, and there's a family maximum of $250. So,
Okay.
For families with multiple kids, it's a good savings. And, some people don't like the idea of having to pay something when they're already paying for insurance, but it can really make, it can be financially smart, because if you have a high deductible, you might go to urgent care and have a $300 bill, even though you have insurance. And so, that would be 4 months of direct primary care. So, so I really think that almost any families I would love to have in my practice. There's not really a certain, families with young kids, especially because they're the ones who are getting sick all the time. And,
Sure.
If you're in and out of the clinic because they have colds and coughs and fevers, it really makes sense for for families with young kids. But then, I also do see teenagers who have often a different set of concerns besides all the infections, but things like ADHD, anxiety, depression. I do see kids for that reason, and so that's another group of kids that maybe they don't need a doctor all the time because they're sick, but for other concerns.
Sure. So you don't, do you do OB?
No.
You don't. Okay. So that would be a different thing. So where would you said still have insurance. You're not advocating for not having insurance. Where would you be seen versus go to the emergency room? Are there things that you would refer to, like, I don't know if you do labs or x-rays or things like that. Is that something you would refer to somebody else and then have them deliver that to you as like a partnership? How does that work?
It's really important to know that direct primary care doesn't replace emergency care.
It's good to know because I work EMR, so
Oh, okay.
EMS. So
Okay, yeah. And a patient might call me and say, my child has 105 fever and a headache and a stiff neck, and I'm going to say go to the emergency room.
Good.
Or if you think your child has a broken bone or some kind of serious injury, I do try to see people the next day or possibly the same day, but it's not the same as like a walk-in urgent care. You have to contact me and we set up an appointment.
And that's really no different than, I mean, we've all been to the emergency room. They take care of the emergency, stabilize you, and then the first thing they say is set up an appointment with your primary caregiver. That would be you.
Right.
Okay.
Yeah. And for things that aren't emergent, I definitely I can order labs, I can order x-rays, which would be done at one of the hospitals or,
And those would be covered through like an insurance.
Those, yeah, I would, as much as possible, find a way to have it covered by their insurance, which shouldn't be a problem because, I'm a board certified doctor. I have licenses in Wisconsin and Minnesota, and things that I order should be covered on their insurance in most cases.
Sure. So some of your history, you worked at Regions, is that correct? And then in Winona so where did you go to school? Like how long have you been a doctor, and what type of a doctor have you been over the years?
Well, I'm originally from Texas, and I went to medical school in Galveston. I did my pediatric residency in Little Rock, Arkansas. And then I actually came to Minnesota to do a fellowship in nephrology, which is kidney disease in children. And I was, when my my counselor, my mentor in Arkansas said, well, you should consider the program in Minnesota. I was like, do people really live in Minnesota? I mean, isn't it like...
Only if you ski.
Isn't it like igloos and blizzards? And so I was supposed to come up here for 3 years, and now, more than 30 years later, I'm still here, and I love it. I didn't finish the nephrology fellowship because I found it just wasn't for me. it was more like doing an intensive care fellowship.
Interesting.
Lots of patients I had had really serious disease and fatal diseases, and I was a new mother, and working with parents whose children were dying, just that wasn't for me. I'm glad there's people that can do that, but not me. And so that's when I went to Ramsey Hospital, which is now Regions.
I remember when it was Ramsey.
Okay, I'm glad somebody else does.
I was very young at that point, but my brother was born, I believe, at Ramsey, and now it's Regions.
Yeah, and Ramsey was so cool. It was like the county hospital, and we saw, kids from, so many different countries, and it was really a lot of services for families, and I really liked that. And
Cool.
Then it kind of changed to more of a
It's kind of a big hospital now. Our local hospital partners with them and sends our trauma care to them. So if we get a life flight in for an accident or a heart issue, that's typically where we send them is to a cath lab in the cities. It's usually Regions or something like that. So from the perspective of the patient, if you have a patient and it's $75, is there a point at which you say, stop calling me? You're too nervous. Or do you really is it really an unlimited amount of Q&A and things like that? Like how do you balance your time? Because you got to work with the chickens in your garden still. So
my grandkids.
And your grandkids,
Yeah. At the beginning, I do talk to families about, boundaries, and you can send any number of texts or questions, but, I want people to know that, if you text me with something that's not urgent in the middle of the night, I'm not going to answer until the morning. And, we kind of set up some guidelines of, if you really are in a panic and need to talk to me, then I would have you call my phone number instead of text, just knowing that, I'm not going to check texts until the morning.
Sure.
If someone is really nervous, obviously nervous and sending texts all the time, then I would want to talk with that person about, what's going on with them.
Sure.
Is there something else that is
maybe they're more
going
than
on.
an anxious parent, or there might be something else. That makes sense.
Yeah.
So from your location in St. Croix Falls, just to kind of recap, you do pediatric primary care for families with kids from 0 to up to 18, and you have a unique practice that doesn't necessarily have to meet in an office setting, but you do have an office in Osceola, which I didn't know, so that's great to know. Otherwise, you are available to do visits at homes, which is kind of a fun way to make it less stressful for new parents, and probably gives you some insight into some of how they live and some opportunities to help them with their health care from that perspective too. But also for non-emergent things, you handle things over text, over phone, and video. So you do like conference calls. And you're non-insurance. You don't take insurance, but it's a membership model where they would pay $75 per child per month with a $250 max per family. Okay. And so what do you have any non-HIPAA violation stories of good experiences that parents have had or that you've had with parents where it would kind of be like a case study that you could share where someone really benefited from this type of a model over dragging the kids all into the car and going to the clinic for their 15-minute visit?
Yeah. Well, I just started, so I don't have very many patients.
Okay.
I do have one story from a direct primary care pediatrician who maybe I shouldn't say this because it's not going to be standard, but he was seeing a 4-year-old with abdominal pain and fever. He went to the home and thought that the child had appendicitis, and so he told the mom that she needed to take the child to the emergency room. And the dad was out of town, and so the mom said, well, I'm not sure what I'll do with my other child, who was like 8 or something. And he said, well, how about if he just comes to my house and has a sleepover? Because
That's different, yeah.
because his kids knew this child,
Sure.
and so yeah, I'm not going to offer sleepovers,
Right, yeah.
not very often, but it's just so different. It's so personal, and
Yeah.
you know, doctors really get to know the families, and
Right.
families get to know the doctor, and that's, to me, that's what makes medicine fun, is
Right.
the relationships, and when you're rushing people in and out, and someone else is setting your schedule, it's hard to do that.
Yeah. So when would a person contact their primary care doctor to make a visit for like a regular physical type thing once a year? And then what other things do you deal with? Bladder infections. I'm thinking through my kids' history.
Yeah.
Not eating or throwing up, being sick. Those are all things that you would go to the clinic for. So anything that you would typically go see your primary care doc, you would be able to handle all those things?
Yeah. Well, in the first few years, children need lots of well-child checks. 2, 4, 6 months, 9 months. So, that's checking on their growth and development, and talking about, feeding and those kind of things. So there's a lot of visits then. But I also see kids for problems like, one that's pretty common is constipation, which can be a really difficult problem for kids, and kind of life-changing when it gets taken care of, because they're, having stomach aches all the time, and, it's very treatable, but a lot of parents just kind of go, well, he goes 2 or 3 times a week, and that seems okay, and
Right.
things like that. So, the chronic diseases like asthma, allergies, those kind of things. I see kids
Yeah.
for that.
So how do people, and I realize you said you moved here in July, so it's only September. So you've been in St. Croix Falls for only 2 months. So this is a brand new practice. And you are just getting started. So how do people who might be interested in this type of a model get in contact with you?
The easiest way is through my website, fullcirclepediatrics.com. And there's a link that you can click on to set up a meet and greet with me.
Okay.
You just, the calendar pops up, and you put in a time that you want to meet. And that can be either in person or by phone or by video.
Okay.
So that's the quickest way to get started, is to, talk together and,
Okay.
see if it's a good fit for your family.
So if you put a pin in St. Croix Falls, 30 minutes, I don't know how far that is, but do you do Minnesota as well?
I do.
Okay, so you're licensed in Minnesota and Wisconsin, and so that would be like Chisago County, down towards St. Croix County,
Yeah,
Osceola,
New Richmond is
New Richmond.
about the farthest
Okay,
point.
and that's kind of right in that St. Croix County. And then east would be into like Turtle Lake, would be about 25 minutes. Okay.
Yeah. And one other thing is, if someone is outside that range, they can still sign up, but I wouldn't necessarily do home visits.
Okay.
They could come into my office in Osceola,
Okay.
but they would still have, access to all the other, like, text and phone calls and emails. So I just wouldn't guarantee home visits if it's
Sure. That makes
outside
sense.
that range.
I think that's reasonable. And part of that, too, like back to Dr. Hedlund, my family doc who delivered our 5 kids and, was giving me physicals and my wife physicals. There was a relationship there. And so I would have driven 30 minutes to go see him. because of that relationship, and would postpone my physical if I couldn't get in to see him for a little while because he was so thorough. Sometimes it was hard to get in to see him, but we made it a priority, and then he would prioritize us as well. So totally understand that. So your website, do you have anything on Facebook yet, or?
I do have a Facebook page.
And probably from your website you could find that. So if you're looking for information on finding a different kind of more home style friendly, small townish, I don't know how to describe it,
Yeah.
but it's attractive to a lot of people versus getting into the system. Dr. Vivian Rider would be a great option for you to check out if you live in that kind of bubble of 30 minutes from St. Croix Falls. And the website is fullcirclepediatrics.com. And so you can go check that out. Affordable membership-based pediatric direct primary care with unlimited access with home visits, calls, emails, text messages with high-quality care for busy families. That sums it up.
Yeah.
Anything else you'd like to say?
Well, I'm so happy to be here. This is a beautiful area and so friendly, and I feel like I'm just jumping right into the community. I've been working at the POP table, Power Produce table at the St. Croix Falls Farmers Market, and I just love getting out and meeting the community and feel very welcomed.
Yeah, so right now, St. Croix Falls is starting to see our leaves change. And so if you're looking for a place to go visit for leaves in the next 2 or 3 weeks into October, that's when everybody comes to visit St. Croix Falls. The river valley along the St. Croix River, St. Croix Falls has a view of Minnesota, and we get to enjoy their leaves, and then vice versa. They have a lot of people that come to view our leaves. Interstate Park, of course. If you're not opposed to canoeing in a little chillier weather, canoeing down the river through October is a great way to enjoy the leaves. And it's just a beautiful, all the way down to Osceola and beyond. It's beautiful. So you picked a good time. Now, unless you snowshoe or snowmobile or something, winter may be a challenge, but you'll have to let us know.
Yeah, actually the first time I saw Tiny Timbers, we snowshoed around.
Okay, good.
Because it was still there was no buildings there. So.
Oh, okay. So you saw it early on. My family loves to snowshoe as well. And last year was a real drag because there was hardly any snow. So this year I'm kind of half hoping that we get some snow, but I also really like not having to plow and drive through the snow. So, well, thank you so much for being here. Again, it is an honor to be able to talk to someone in the community who wants to make a difference and plug in. There's so many great opportunities to do that. So get in touch with Dr. Vivian Rider at Full Circle Pediatrics with an S.com, and we'll look forward to seeing you again soon. No questions from the audience, and there were people live watching. So if you have questions, please reach out to her through her website, and we'll look forward to.
Yes, and they can also email me on the website. It doesn't have to be a meet and greet. You can just email with a question.
Awesome. Well, thanks for being here, and we'll look forward to seeing you out in the community.
Okay, thank you.
Yeah, thank you.